The Visualisation TEP, the Therapy with Energy and Process, by Vivienne Rauber, Swiss psychologist, Lesson 7 of the Self-Healing course, the advanced one. Here, Lesson 7, a demonstration how to work with a symptom. Here, a tumor that was just diagnosed.
Thanks, Maria, to help me go and visualize a symptom that I was just diagnosed yesterday, and really by chance, because I had back problems and I had an MRI for hernias, and they found 3 disc hernias. But at the same time, in the MRI, they said we also see a tumor of 6 centimeters, multi, and that I should go and see the gynecologist, which I did. And so he saw in the ultrasound, they show you on a video, what you see gray something and you have no idea what it is. But she said it's a tumor of 13 centimeters, so it's like a grapefruit, but that big, in my belly. And she said it has to be operated immediately, because we don't know if it's going to be a bad cancer or not. So I just like to visualize this. It says it's like a very heavy, thick ball.
Okay, so I will ask you if you would like to have a higher presence here guiding the process.
Yeah. I'd like to ask the divine wisdom to be with us.
We welcome divine wisdom at this moment. Okay, and I will ask you now, please, to close your eyes for a few seconds and start breathing in and out, going all the way up. The air comes in through the soles of your feet. Yes, both feet on the ground, it helps a lot. And
you mean the parallel breath?
It is a parallel breath, yes. So the idea is that you imagine 1,000,000 little tubes going through your body, from top to bottom, from bottom to top, through which the air is flowing in and out of your body. Very calm. Yes. And very centered. Very good.
And I'm trying to feel now whether this parallel breath goes through my whole body, concentrating, of course, in my lower belly, to see whether it can pass.
Yes, that's what I wanted to ask you to do.
It's kind of strange. It's like up here I feel like lines of breath going through. And down here I feel it's different. It does. I have the impression it does go through, but not with the same intensity. I'm trying to see it's everywhere, but like in the lower belly on the right side, it kind of goes through. And on the left side, it's just going through like if it was with less power, like being not as loud, like being, and here in the middle where they diagnosed this thing, also goes through just a
Okay.
little. It's like it's not showing anything like in normal symptoms that it does go through or not.
Okay, it's very interesting. I think it is the right moment to bring out. So, if you could put an image that would have to do with this tumor, with this conglomeration of cells.
Before I'd like to feel whether I can feel anything. But again, right now, if I think of it, it's like a little saying I'm here, but it's not, it's neither a pain, and it was diagnosed not because I had a pain, I had a backache, and I had a, how do you call a Hexenschuss in English?
I don't remember, but it hurts a lot. It hurts a lot.
I couldn't stand up, so it had nothing to do with my belly. So this was just diagnosed by these machines they have now, and without them I wouldn't even know I had it.
So we bless the machines too.
So you say let the picture come?
Yes, allow a picture to come.
Well, I see the picture that I saw yesterday on the screen when they did the, which I don't know how you say it in English.
Ultrasound, it's called ultrasound in English.
Yeah, when they said they put that ultrasound, so you see on like a TV set,
Yes,
you see
indeed.
grey things, a little more grey, a little less grey, and they say intelligent things about it, and you have no idea. So,
Would you like to work with this image?
yeah, so I see just now this great image, and I'm already seeing it out there, like on a screen.
So do you have it 2 to 3 meters away from you?
Yeah, it's already there.
So that it is not within your field
No.
of energy. So it's outside your field of, main field of energy. Very good. Okay, so now we can start working with it. I will ask you now to kindly pass again the parallel breath through this image.
So I'll just go the parallel breaths in front of me, putting a higher vibration.
Which is what parallel breath does.
It's interesting, while I'm there at the same time now, here I feel like on the left side, down here in my belly, pain is much too much.
Okay.
I just feel something.
So please concentrate on the image outside of you. And now I will ask you to imagine that earth energy is going to start flowing up into the image.
I would like you, in this case, to hold my left thumb, because the earth energy, it feels so nice when I feel your loving holding my thumb, and the thumb feels like loved. I can much better put this earth energy every time I breathe and see this earth energy go up through this grey picture that didn't really change. It's still a television screen. A television screen like that up in front of me, and yeah.
You know, I would really like for you to breathe this earth energy slower. breathe into the image in a much slower pace. I am holding your thumb lovingly, and you let me know when the image changes.
It's still the same image, but now I see on the left and on the right a woman doctor in white, and on the right a male doctor in white.
Okay.
It looks like a hospital.
All right. Looks like a hospital.
Cold.
In that case, I invite you to process with the rays of the sun.
And I'm happy if you could hold my little finger and giving it warmth.
Give you warmth and love. Allowing the rays of the sun to go through this image, and you please let me know when it changes.
Now there is this instrument where they put like blood conserves in it, and yeah, now I see also a person lying there with the blood conserves and the two doctors from both sides.
Okay. Pass in, allow the wind, breathing to go through there. And now I am holding your annular finger.
Now they're running like crazy with a patient there, and the two doctors on the side and behind. There is a help also in white, pushing very, very fast towards, I guess, the operation room. I don't know, that's just along the wards of the hospital they're running.
What happens if you let water run down?
The rain, okay.
The rain. Now I'm holding your index finger.
Protection. Yeah, let me feel this protection. Well, now we are in the operation room. I seem to be the patient. And they start operating. They've done the narcosis. They make a big cut through the whole belly and start looking and finding this ball, this tumor. Now there are two of them, two doctors, and then now there are also assistants there who give the instruments. It's an operation room, and it's an operation that's happening.
Okay. So now I invite you to work with the universal light onto this image as we are increasing the vibration rate of the image. Now I am holding your middle finger.
Now I see they have cut out a tumor. It looks like the size of an orange or a grapefruit, and they take it out. and they bring a sample to see if it's a benign tumor or not. And in the meantime, they keep on looking what is happening. It looks okay. It looks that the big intestine is not affected, the colon is not affected. They can they could take this tumor out without injuring that. And they're kind of looking and waiting for the results of the function.
Okay. Please do again the earth rays.
Mm-hmm.
Can you let me know when the image changes?
Now my daughter came in, who's a medical doctor in a white gown, and also my father, who was also a medical doctor. And they come in a white gown. And I know it, although I'm in narcosis, I feel their presence and it feels very good. It feels it's okay now. Whatever happens, it's okay. They are here.
Would you like to stay with this image or?
No, I would like to hear what.
Okay,
what the result
we'll continue with the
is.
results. In that case, I suggest we work with. What would you like to work with?
With the universal
Universal light.
Yeah. Now a sister, you call them sister?
Nurses.
The nurse comes in, also in white. Although it's strange, usually they are green in the operation room, and she's in white. And she brings the result and says it's not cancerous, it's just a benign tumor.
Mm-hmm.
So they all start closing the whole wound again. And now it's my father who does it, and he does it just the way he taught me when I was a little girl, and also was allowed to go to the hospital and help him operate, although I hadn't studied medicine. He is closing it. And now my daughter is doing some energy work on the wound, like to and not, I don't know how you say that in English, to take the energy so that the wound will heal quickly.
Mm-hmm.
Yeah. Now it's finished. They bring me back to the room, private room. My father leaves, goes to heaven. And my daughter stays with me to wait until I wake up out of the narcosis.
Does it feel complete? Would you like to integrate this image? Or is there still...
I guess I want to wake up.
You want to wake up, very
And
good.
I'd like to have the earth energy again. Loving earth energy.
Loving earth energy.
Yeah, my daughter stays there. And there isn't a nurse because she's a medical doctor, so they thought it was okay. They didn't need to leave me in the intensive room. And I open my eyes, and she's there, very loving, and tells me it's okay. Holds my hand. And now my 4 grandchildren come. And they bring the cat. And so I feel the cat that just died is somewhere with my father, somewhere like above. And my husband comes and holds my right hand, and all the 4 grandchildren. Sit around, and it feels lovely. And it feels, yeah, it's okay whether that's the time to continue living and getting well, or if it's a goodbye. My grandchild Vivienne just told me yesterday how their cat had died and how they all went to the hospital, and the 4 of the family members said goodbye to this little cat who had broken her back and was going to be killed with an injection. But it was like saying goodbye and thanking for all that love that this little cat in her 3 weeks that she had been there had given to all of them. And it feels like all this loving family is here. And it's kind of, doesn't matter whether it's a goodbye or whether it's a hello, we continue.
We continue.
You, Vivienne, will continue.
Yes, we continue.
Because I just told my daughter yesterday that when I was diving last week in Greece and I saw these wonderful plants below, I had told them, yes, I want to live. I still have things to do, go out into the world
Yes.
and teach
Yes.
my finger game and my visualization and help people get well by themselves.
Oh yes, we do.
Yeah, I can integrate this picture.
Very good. All right. So
I'm going to take it.
you take it in.
I'm going to put it where the tumor
Yes.
was.
Was. It has been removed, so you are very well.
And I'm trying to listen to the words that accompany the pictures. And it was like, the pictures are like what we said to this cat that just died. Thanks for all the love you gave. Thanks for all the love I received and receive. And it may be still time to give out more love. To make it short, thanks for all the love. This includes thanks for all the love I received and thanks for all the love I can give. Thanks for the love. Good.
Family hug. Oh, my dear. There is so much for you still to do in the world. We need you. We appreciate you. We honor you. Yes. This is really important that you are aware. You are a hero to many of us. You are one of the most complete women I know. And let me tell you, I've had the privilege of knowing fantastic women all my life. And I am very grateful that you are one of my teachers. Yeah. So I can only recommend you to put in practice everything that you know, so that you can continue recommending to other people and teaching your wisdom. Yes.
Yeah.
This
Also
is
with my
really
last
important.
accident, I thought if it doesn't help anything else, it certainly has helped me.
In what way?
When I broke my neck
Yeah.
many years ago.
Yes. How has it helped you?
It does.
How?
Well, all the CDs in those days that I had, where I was still listening to all the CDs.
Ah, your own.
You're
You're taking your own medicine. That's very good. And walking.
First in Spanish, then in German, so I reheard and.
It's very good. It's very good. No, but really, it's. I'm not kidding about this. It's a time to use your own medicine.
Yes.
You're highly energetic. You're an energy medicine woman, huh? And it's It's truly time to put into use everything that you know, with your heart, with your mind, with every single cell in your body.